Now where is LU6 point is located? Try to find out is the proper location. You will come to know where exactly what are the properties of that point. So now this point is how many chun from here to here? From here to elbow to the wrist, how many chun? 12 chun.
12 chun.
Yes. So how to locate that point? You can use it in the finger measurement 3, 3, 6 and then 9 and then 12. So in this way you can measure, but now 3 chun, then further 3, 6 chun, 9 chun, then 12 chun. Right, in this way we measure one method. Now I wanted to use this method as I just select in this way exactly on the Li11 or the Lu5. I just Li5. So I just selected is the middle. This is the middle. So this how many chun? Then you measure 3 plus 3, 6 chun. Right. From here 3, again 3, 6 chun. Center point is this 6 chun. Now where the Lu5 point is located? 5 chun below from the Lu5, the point to be known as a Lu6. Then Lu6 you can measure as a 1 chun and then apply here. But this is the Lu5 point is treatable for the what condition? Somebody come and then apply the needle. Please come quickly and then apply the needle, that is Lu5, Lu6. Good. So now we applied the Lu6. So now try to recognize what exactly I wanted to say you. There is the C cleft point. C cleft point or the Rimic point. R-I-M-I-C, Rimic point. So what exactly this is the C cleft point? Two things you keep it in the mind. Yeah, two things you keep it in the mind. One, anything connected to the blood. Anything connected to the blood related disorders and also blood related disorder or acute related problem. The chronic problem and acute problem, the organ related disorders. The respective organ related disorders can be treatable by using the C cleft point. Each and every meridian you have one C cleft point. Each and every meridian you have the son point, mother point, grandmother, grandson point, horary point. That means is the 5 shoe points, isn't it? So therefore every meridian when I talk, so you have the C cleft point. So therefore Lu6 is the C cleft point, that is the Kungzi is the collection of the whole. So that indicating what happened, the energy is moving from the Lu1 Chungpu, then it comes to the Yunmen, then comes to the Tianpu, Siapai, Chiza. From the Chiza it comes and the energy goes to the deeper level. The energy goes to the deeper level. For example, there is a Sangam. There are the 4 rivers are meeting at a time. So once it rivers meeting at a time, so then what happened? The energy or the water goes to the surface level or the deep level? It goes to the deep level. Likewise, the energy is moving from that place and then comes to the C cleft level. So there that energy goes to the deeper level. From there it communicates to the deeper meridian. Again it comes to the surface meridian. Then it passes to the Lu6, Lu7, Lu8, 9, 10, 11 like that. So therefore, the C cleft point is good point to treat for the organ related disorder and also the emergency conditions are related to the respiratory asthma, shortness of breath or emergency conditions of the breathing difficulties. That condition suddenly started the allergy. So the third is the hemoptymesis. That's called as a hemo. Hem means is the blood. Emesis. Emesis means is the vomiting. So hematemesis, so that indicating for the blood vomiting condition also can be treatable by using this point. So hopefully you understand. So K6 point is the C cleft point. Now coming point is the great point to treat for the lungs 7 point, that is a LU 7 point. For the day-to-day clinical practice, every day I use this point for the known and unknown cases of the many more diseases. Now let me see where the point is located and then we will see the properties. So LU7 for the day-to-day, normally I uses this point. How need to be activated? So you just use this point. Two directions I just apply. One direction to be known as a 1.5 chun proximal to the 1.5 chun proximal to the lateral wrist crease on the medial side of the styloid process of the radius. Now I just, okay, I think that would be better. I just applied towards the please remember, this is the most one of the, on the lungs meridian, the top 3 points, among them this is the most important point, right? So now LU7 point, where exactly located? 1.5 chun proximal to the wrist crease. I told you this is the nexary point, this is the luo connecting point, this is the passage point, interior and exterior communicating point, and also it is the confluential point for the Renmai meridian. So therefore numerous properties are there by using this point. Distal point for the occipital headache, distal point for the nape, distal point for the upper back. So therefore lot of related conditions. All the ventral side of the body can be treatable by using the LU7 point, right? Now you recognize how we need to keep it, all these things in our mind. One, first you keep it the location. The second location, anyone, do you have the doubt? So LU7 I just applied towards, because this is also exit point, this also exit point, that means is a sedative point. Exit point means sedative point or the depletion point. That means is the exit point connecting to the large intestine. Large intestine, lungs meridian starts from here, terminated the energy here. LU7, the energy get over. Exit point that connecting to the lungs is communicating to which organ? Exterior and interior. Exterior and interior to be collectively known as a lungs and large intestine together. We need to treat by using this point. So therefore once you applied this, you are treating to the large intestine. Once you applied in the upper direction towards the lungs, that you are treating to the pulmonary system. Yeah, that also I'll come now. So hopefully we understand LU 7 points. So LU7 point is the person who have emotionally affected. Remember, this is a very important. All the luo connecting point, Sunlu, Sulu, Fulu, Great Lu. So there are the few luo points are existing. All the luo points are treatable for the all the respective emotions. What is the lungs having the emotion? Very good. Grief and sadness and worries and pensiveness, anyone having the problem, lot of grief is there with them, then definitely you just activate this point. Slowly grief will convert in the form of the willpower, isn't it? So therefore whenever we feel that most of the women, most of the men today, they are not very happy, one or other way there is the problems are there around us. So to avoid that, we can use the luo connecting point. H5 is the overjoy or the underjoy related problem. When overthinking, then spleen 4 you can use it. The person having the fear of the complex, then use the K4 point, right? When there is the person having the anger and emotion and furious, too much angry, that time you can use the LIGU, that is the liver 5 point. In that way, you just use the LUO connecting point is the really good to treat for all the emotions. So hopefully you know that, but LU5 point, LU7 point is great point to treat for the lungs disorders, large intestine disorders, and also emotional disorders as well, isn't it? And by the way, this is the distal point for the nape and then it's called occipital headache. Sir, what does it mean is the distal point? Keep it, there are the 6 distal points are there in our human body. How many points? 6 distal point. Among them, quickly I'll tell you, one is the LU7, the other one is the LI4, the third one is the P6, fourth one is stomach 36, the fifth one is the spleen 6. Right. So then the another last one is the UB40. So these are the 6 distal points are existing in our body. If you use only the 6 distal points, you can treat to the whole body as well. You can treat to whole body as well. So therefore LU7 is treatable for the occipital headache. If the person having the neck pain and occipital headache, scapula pain, upper back pain is there, that time definitely you can use the LUO connecting point. LU7 is the distal point for this entire region, isn't it? And also women having the pelvic related disorders, but we cannot apply for all the women below the navel region. So that time what you need to do, use the complementary point, that to be known as a LU7 is the confluential point for the Rennes meridian. Influential point is different, but confluential point is different. LU7 is the confluential point to treat for the many disorders of the woman, especially below the navel or the ventral side of the body, or the GIT related disorders, gastrointestinal related issues as well. So hopefully you understand LU7 is the great point to treat for the lungs disorders itself. Whenever patient feels the cough and then congestion, so normally day-to-day cough people have, so that time you just apply the LU7 to treat for the cough generally. So now we need to recognize LU7 is also good point to treat for the all the arteries or the blood vessels of the hand. All the arteries. What are the artery? Radial artery, then ulnar artery, the medial artery, then the axillary artery, right? Biceps artery. So on we can treatable by using the LU7 point. LU7 is the junction point to treat for the blood vessels of the upper limbs, especially the upper extremities, hand related disorders. Now we are talking about the LU8. Now exit point, which I told you it's exited. Now I wanted to get the bifurcation, the another route. There are the 2 routes are there. Once I wanted to go, for example, when I am going to my native place. So my native place, I have entered to my native place. I reached my destination. My destination, I wanted to go to my respective people. There are again 2 bifurcation. One, my mother is staying somewhere and my brother is staying somewhere. So I wanted to meet my brother. I need to go from there, the different route. My mother wanted to see, I need to go the other route. So therefore, all are located on that location only. So therefore, the small bifurcation to be taken place. In that way, LU7 point, now I take the bifurcation to regulate to the regular meridian. To regulate to regular meridian. Now I wanted to use LU8 point. LU8 point, where exactly this point is located? Wanchon proximal to the Taiyuan, LU9 point. So where is first we go for the LU9 point, then we'll go for the LU8 point. So now how to locate the LU9 point? Now you remember this is the thumb, you come down, this is the wrist crease. When this is called as a ventral wrist crease, this crease called as a dorsal wrist crease. Now I wanted to select as a ventral wrist crease. On the ventral wrist crease, the wrist bones are there. How many wrist bones are there? 8. So in that 8 bones, but midway between the scaphoid bone and trapezium bone, midway between the scaphoid bone and trapezium bone, the point is located, that point to be known as a thigh yuan. That is LU9. You first touch and feel. You look at about the radial artery. You escape the radial artery. Before the radial artery, the point is located. Before the radial artery, the point is located here. Thank you. Yes. Now you just see this is the radial artery. I am palpating the radial artery. I am palpating the radial artery. I am palpating the radial artery. Now beside of that, posterior to the radial artery, I just applied posterior to the radial artery. See, now you can have a look. This is the posterior to the radial artery I just applied. That means I didn't test to the radial artery, right? So this point to be known as a LU9 point. When I wanted to apply on the radial artery, yes, yeah, on the artery I just applied. That is slowly what happened. Do you feel some kind of the pain? Yeah, it touches to the radial artery. So once it touches to the radial artery, the needle slightly shake. So once the shaking to be taken place, that time withdraw the needle and then apply to the lateral position, but that needle retain the same. That will not get shake. But most of the times when you apply to the radial artery, needle slightly get shake, but that shouldn't happen. That means you applied on the artery, you just apply beside of that. No? So LU7 point, you can ask me to change the slide. So whenever I am talking the some other point, but you just tell me to change the slide, I think you can have a look precisely where is the location. Then LU8 and then LU9. LU7 is completed, how the energy is coming forward direction, you just have a look. This is the LU9 point, that's called as a thigh yuan point. All of you try to find out, and then you just take it as a marker. You just take it as a marker, or you take it as a pen or pen with you, and then mark it where exactly you are identifying the points. All of you, please try to mark it where the points are located. After that, I will try to see you, then what the mistake you have done, I'll try to correct it. So hopefully you understand LU9 point. Before that, LU8 point, one tune above to this point, this to be known as a LU8 point. LU8 point is the horary point. LU8 point is horary point. Yes, that indicating you wanted to treat for the lungs itself without bothering to anything. You treat for the lungs. You are treating to the lungs. You treat only for the lungs. Don't interrupt anywhere. You just use the LU8 point because it is the metal point or the air point you treat, because the beauty of that point is connecting point to all the venous system of the hand. The upper extremities, all the veins are connected on the LU8 point. So therefore, whenever there is the lungs related problem you wanted to treat, you treat by using the LU8 point. Is always is good to treat for the all the pulmonary related disorders. You need to activate as a tonification, or you wanted to sedate as a sedation. Now we recognize what is the organ clock timings of the lungs. 3 to 5. Yes, 3 to 5. So this point you wanted to use. 3 o'clock onwards you just use as a tonification. So I just use it as a tonification. LU8, 3 o'clock you just use it. This is for the tonification. 4 o'clock onwards you wanted to use in the morning. You just sedate. You can use the point LU8 as a sedation after the 4 a.m. in the morning. If may not be possible, then use the 4 p.m. in the evening time. Isn't it? In that way you can do it. Hopefully you understand. The LU8 is the coming points are really important point. I just completed this LU8. Now I talk about the LU9 point.
Sir, 4 p.m. then we will use the kidney point, no sir?
No. That is
We
6
use
a.m.
LU8 only, sir. Then we should be using kidney 10, sir. In the evening, if we are doing for the lungs, sir,
Okay.
then we should be selecting the kidney horridina, sir.
By what time?
Like you said, na 3 to 5 is the kidney time.
No.
UB time. Sir.
UB time, yes.
Then we should be selecting the UB60, UB66.
6. Correct.
For
We
the
can use
lungs.
UB66 for the lungs.
Between 4 to 5 p.m. Tonifying UB66 for the lungs, sir, because at that time the lung energy is weak. At the UB time, we can tonify by using the horary of the UB.
To regulate the lungs.
Yes.
Sir, we can use SP5 in morning.
Yeah, SP5 I come to know on the LU9 point. Is the very good. You understand about the horary point and also the opposite time, that's called as a husband and wife law. Is called as a, in the law is there, in the acupuncture, that's called as a husband.
Husband wife.
No relationship. Here is midday and midnight law. Midnight law. Here is that husband and wife law is different, but that is the very great relationship, you know that. At the same time, biggest problem also, you know that. So right, how our Almighty should give the peace and harmony and also good understanding each other. But now you recognize the midday and midnight law. This formula is getting over here. But as you rightly said, lungs problem we can treat at lungs problem you can treat at the evening 4 o'clock. You can use the UB meridian. But what I mean to say, you can use the LU10 point and LU9 point at 4 p.m. I mean to say, you can use that point also. But rather than using the UB point, you can use as a lungs point itself, which is the mother points, mother and grandmother points at 4 p.m. Activation. ಇದು ಆಕ್ಟಿವೇಶನ್ ಸೆಡೇಷನ್ ಅರ್ಥ ಮಾಡ್ಕೊಂತ ನಿದ್ದೆನೆ ಬಂದ್ಬಿಡುತ್ತೆ ಅಲ್ವಾ? ಹಾ ಹೇಳಿ. So now I'm talking about the LU9 is the great point you recognize. LU9, you know the place where exactly. So this is the mother point of the lungs and also it is the source point of the lungs. Whenever there is the lungs energy is deficiency, remember, whenever there is the lungs chi is deficiency, being a mother point, it's activating to the lungs by activating this one specific point. But this treating for the pulmonary artery, this treating for the alveoli, this treating for the trachea, this treating for the bronchi, this treating for the bronchioles as well. As I told you, you just apply the needle, or you wanted to apply the embedded needle, you just take the embedded needle and then apply the pressure on this region. You just apply this, yes. So this is the LU9. You just apply the LU9 point. In this way, you just activate. So definitely this having the people who are suffering for the says, I do have the, for the last 3 to 6 months, 1 year, I do have the cough. So that time what need to be done? When 17 Shenzong and then LU9 point. You just activate every day for the span of many couple of minutes or the days. So continuously that have the great effect to treat for the pulmonary related disorders. By the way, this is the influential point for the blood vessels. Influential point. Confluential is different. Influential is different. This is the influential point to treat for the all the blood vessel related disorders. What is the blood vessel?
Sir, the embedded needle, how long should we apply at LU9?
Yeah, embedded needles you can use for the 1 hour, 2 hours or the whole night. Better you just place it in the night and then ask them to lie down and morning let it be removed off. So whole night can be applicable. If the embedded needle, you just give one packet to the patient themselves and then ask them to give the pressure on that region. They just take this and then press it on the specific point. Mark it there and then apply it. and then let it be continue that. Definitely having the positive impact for the pulmonary related disorders, COPD related disorders, or maybe the lungs or the asthma or the corona related disorders. So after that, the smell, loss of smell, something like that, definitely we can use the Thai Yuan point to treat for the
Few days we can advise.
yeah, 1 week, 10 days until the patient get recovery. Even using the 1 month will not harm. People are using the inhalers and nebulization for the last 10 years. Continuously they are using. Why can't? Yeah, 15 days. Like that, we can pace it for a couple of days. That will not harm. But every day you can make it. Otherwise, give the pressure or PNST, preclean neurostimulation technique. You just place it over there. Give the toothpick pressure on the LU9 point morning and evening. 2 minutes. That also advisable. See, lot of routes are there. So whichever it is not applicable, try to apply this some other route. So ask them, whatever you do the treatment. Later is advisable to the patient themselves, please you can proceed. Otherwise may not be possible. So that's the reason Thai Yuan point is the great origin point. That means the Thai means is the great, Yuan means the original point. The lungs original point to be known as a LU9 point, Thai Yuan. So you remember all the blood vessels, heart blood vessels, varicose veins blood vessel, kidney blood vessel, or maybe liver blood vessel, stomach blood vessel, spleen blood vessel, pancreas blood vessel, anywhere brain blood vessel, or the spinal cord blood vessel, urinary bladder blood vessel, gallbladder blood vessel, anywhere the artery got problem, anywhere there is embolism, anywhere there is a blockage, anywhere the coronary artery get blockages, or the cerebral communicating arteries get blockages, or the radial nerve get blockages, medial nerve get blockages, musculocutaneous nerve get blockages, anywhere something connected to the blood vessel related problem you wanted to treat, definitely you can keep it in your mind. Yes, I wanted to treat LU9 point to treat for the blood vessels. Blood vessels means all the arteries and also related to the veins as well, venous system. So integratedly, even now related problem also you can add up this point is always is good. So hopefully you understand LU9 is equivalent to the spleen 5, Shanchu. Now LU, that means LU9 is the mother point. LU5 is the son point. LU9 is the mother point. Now LU9 is equivalent to the spleen 5. Spleen 5 is the sun point, LU9 is the mother point. Now spleen 5 is the earth point. Spleen 9 is the earth point. So now earth point means communicating to the spleen. Communicating to the spleen. So therefore LU9 is equivalent to the spleen 5. The spleen metabolism related disorders, digestive related disorders, and also the lungs related disorders. When the digestion is not good, then the lungs also get problem, isn't it? So breathing difficulties or the cough and congestion will be happen. So that time to regulate both, you can use the LU9 point is always is good. Then further we will talk about the LU10, that point to be known as a Yu Chi. That point to be known as a Yu Chi. That means is the fish border. So where exactly how to recognize this? When this is the this is the first metacarpal bone. This is the first metacarpal bone. This is the white skin. This is the black skin. This is the black skin. This is the white skin. Now at the junction of the border, fish border of the black skin and white skin, midway between that, at the border of the carpal bone, this point is located. Try to find out the location. This is called as a metacarpal bone. This touch and feel, this called as a metacarpal bone. Just metacarpal bone in the depression. Metacarpal bone in the depression, center of the metacarpal bone in the depression at the junction of the white and black skin, this point to be known as a Yu Chi. That is LU10 point. So LU10 point is which point? Fire point, earth point, metal point.
Fire point, sir. Fire.
So I think come somebody, madam, happy lagaiye, LU10. So LU10 point we just apply, and also there is the another point, lymphatic meridian points also I'll tell you.
LY2, sir.
Yes. Yes, perpendicular. Where is LY2? Where is LY3?
LY3 is at the base of the metacarpus, sir.
Yeah, you just apply. Yeah, you just apply here. You just apply here.
No depression.
Yeah, in the depression only. See, this is the head.
Just below
Distal.
the head.
Yes.
Sir, can you show the needle, sir? Can't.
Yes. Then this is the place in the depression.
Sir,
Now-
needle below.
Yes.
Lower the hand.
Yes, correct. So now there are the 3 points are existing here on the fish border. This meridian also to be known as a lung meridian as per the TCM, as per the modern lymph meridian, LYMPH, lymphatic system meridian. So now there is the problem which I told you. What are the indications can be useful? Eyes, nose, and then teeth related. Any lymphatic system got related problem on this facial region. By the way, this also lungs points as well, isn't it? So therefore, anything the water accumulation on the chest, especially on the facial region, definitely we can use this point. But LU10 point is the great point to treat for the pulmonary related disorders, especially the lungs problem, where the energy having the deficiency. LU9 and LU10 energy is deficiency, and LU5 is the energy excess conditions. Right? Deficiency conditions, what are the points you can use? 9 and then 10 point. You can use. Yes.
LA9.
And also it is the fire point. When the lungs fire get excessiveness. When the lungs fire get excessiveness, due to that reason the patient feel the temperature, and also mouth and nose, he feel lot of heat. The sometimes bleeding may happen. On that situation, you just use LU9, LU10 point to regulate the water, to regulate the heat in the lungs. Isn't it? So therefore, this also very great point to treat for the pulmonary system. So LU10 is equivalent to the pericardium 5 Chianchi, and also link tau, that is H4. LU10 is equivalent to the H4 or pericardium 5. That means it regulates the energy from the fire to the metal. The fire controls to the metal. Fire controls to the metal. So in that way, so this is the important point to treat for the heart related problem, lungs related problem. Both the conditions can be treatable by successfully LU10 point. So what are the organ clock timings? Morning 4 a.m. Morning 4 a.m. have the lot of energy. Right. Morning 4 a.m. energy may not be required. What time it's required? 4
5 p.m.
p.m. is required. Then opposite time. 4 p.m. you just apply LU9 and then LU10 point. 4 p.m. you just apply the LU9 and then LU10 point. So hopefully you are understanding this LU9 and then 10 together. So you can treat for the all the pulmonary related disorders. But I'll do the conclusion before I complete that. So what are the what exactly summary of this point I'll try to conclude, then you will get. Now you have slightly confusion and dilemma, then you need not to worry, that we will going to get the clarity out of it. Now the last one is the LU11 point, and then LU11 bilaterally we can apply. This is as a lymph 1 point and also LU11 point. So we just apply the needle on that region. We can use the half tune needle. We just apply on the LU11. So I just withdraw this needle. Up निकाल दो. आप apply करो. Yes, you just apply on the. Now this the heat has come out. So what is this is LU10. What the lungs heat was there. That heat is coming out. If the excess heat, we can drain out this. Right. So this is one point. The second, we are bleeding that. So that is LU11 point. You just bleed that point. So first you hold properly. Yes. And then apply. Only one prick you just apply. Only one prick you just apply the lancet. Leave it. Yeah. So I'll show you how to do that procedure. You just take this lancet and bring to the points exactly and then puncture it. So you just leave it, let it be there like this for a few minutes. Possibilities are there. Or I wanted to withdraw immediately the blood. I just insert this and then withdraw. Then I just try to get into that some amount of the bleed. I just wind up like this. I wanted to bring some amount of the blood. Yes. So like this we can do it, but we can use the gloves and then use it. That always is good. Or we can apply the LU11 on the other side also. So on the other side also you can apply. As per the Dr. Volz, LU11 point is located on the not on the radial side, on the ulnar side. On the ulnar side, LU11 point is located, but this normal TCM LU11 point is located on the radial side. However, bilaterally you can use it. That both the ways is really good for any lungs related problem, lungs drainage conditions. You can use it, but especially LU11 point is good point to treat for the palatine tonsils. So normally tonsils we do the surgical removal. So surgical removal, tonsillectomy done only for the palatine tonsils, not the other tonsils in normally. But that without removing the tonsil, you wanted to use the one specific point, that point to be known as a Shaoshang, that is LU11 point for throat irritation, dry cough and congestion, and emergency point for the lungs related disorders. And also all the people who are suffering for the skin related disorders, you wanted to withdraw that some amount of the blood. That also good for the purification of the lungs and further to detoxify the pulmonary system, to treat for the integumentary system. So hopefully you understand.
Sir, please, sir, after my eye operation, always I have eye dryness. Can you help me by telling something?
Yes, after the eye surgery, having the eye dryness is having the more problem.
Always dryness.
Yeah. So in this case, we try to find out one point. Generally, you can use it LU10 point. Please, you just use it bilaterally. If the single eye is there, better you use it bilaterally, LU10 point.
Both eyes.
Yeah, both the eyes, use LU10 bilaterally. And further, you wanted to use which is the dryness point of the liver and which is the dryness point of the gallbladder. Yeah, liver 4 is the dryness point. Very good. Then, which is the dryness point of the gallbladder?
Your 2 sedation, your 3.
No, which is the dryness point?
Dryness point.
Yes, GB44 is the dryness point. You can use this point, number 2. Number 3, if the dryness having the more problem, what is required? More dryness and heat gets excessiveness. What is required? Coldness is required to increase the coldness. So you can use the increase the coldness. You can use the point is, yeah, water point of the liver. That is liver 8. You can use it. Liver 8 is always is good, which is the water point of the gallbladder. GB 40.
44.
43. 43 point.
43.
Yeah, 43 point. You just use together, these are the points. That's really good point to treat for the many more diseases related to the eye conditions. So now I wanted to tell you one more is the key point to treat for all the lungs related disorders. Only single point to treat for the lungs disorders is the lymph meridian point. That means is the Dr. Volz point, that is, but I think you know very well. But I'll try to show you where this point is located. So lung meridian is this meridian. As per the Dr. Volz, lungs meridian is index finger side. This is as a lungs meridian. This is as a controlled measurement point to be known as a LU lungs related disorders can be successfully treatable. I'll try to show you. This is as a interphalangeal joint inside of the radial side, inside of the index finger side. You just apply this for all the lungs related disorders.